Welcome to Live Better Without Surgery. I'm Dr. Joe Albano, your guide to exploring the innovative world of regenerative orthopedics. Join me as we uncover non surgical solutions that give you hope to move better, feel better, and live better. Let's dive into this fact or fiction. We can't use Mythbusters because that's already been taken, but that's kind of what this is. So, this is for you if you're considering regenerative orthopedics, which is the use of amniotic or umbilical or placental tissue or PRP or fat or bone marrow for any type of musculoskeletal condition. Depending on where you live, you may be inundated with this type of stem cell advertising. And we know that all advertising is completely honest and never misleading, right? And here's an example I just saw today. It was a picture of an x-ray that had of a knee that had no joint space, and that was the before picture, and lots of joint space, and that was the after picture. The before picture said pain, the after picture said no pain. And that's very misleading. For example, you can have minimal joint space and have no pain. I see it all the time in my patients here. That's not the knee that hurts them, it's the other knee. So that's very, very misleading. First, let's get to some definitions here. Mesenchymal stem cells, or MSCs, what are they? If you remember from our last podcast, we talked about Calvin and Hobbes and the transmogrifier. So Calvin had this box that was cardboard box, and he wrote on it transmogrifier, and he went into it and he turned into a dinosaur. So that's how we think of stem cells, or at least used to think of stem cells. And some people think of this way now, that you have a stem cell and you put it somewhere and it magically transmogrifies into something else. Well, we know that MSCs, mesenchymal stem cells, are now known as medicinal signaling cells because the way they really work is you put them in somewhere and they call other cells to the area and it helps it to heal. We went over that in the last podcast, and that's the way it works. So they're MSCs. So that's the definition of a quote stem cell. These cells are really great for healing, but are they the fountain of youth? Are you going to be like you're 20 again? No, but it definitely can help you take steps in that direction. So let's talk about the two major types of stem cells. There's autologous, which is from your own body, and allogeneic, which is not. The autologous ones can be PRP, or platelet-rich plasma, your fat, your bone marrow. Bone marrow has stem cells. Fat has even more stem cells in there. From not your, or cells that are not from your body, we can think of those they can be embryonic, so the baby, and nobody uses those clinically because what happens is there are cell lines that they're using in research. About 30% of those cause cancer clinically. I think that's God's way of going, yeah, you're not using my kid. So that's not what's used when you're talking about quote stem cells from allogeneic or not used sources. There are other sources, that things that are going to get thrown away. So there's the umbilical cord, blood. There's Wharton's jelly, which is in there. There's placental tissue, amniotic sac, amniotic fluid. These are all examples of cells that are not from you, and your body does not reject them, and they can be helpful. Talking about these allogeneic cells, which are not from your own body, it's said that there are lots of young, healthy stem cells in there. And that makes sense because it's a baby. Babies grow a lot, right? The short answer is, drum roll, key it, no. Does fresh tissue have live MSCs? Yes, it does. However, we do not ever get fresh tissue. What happens to get fresh tissue, or what has to happen to get fresh tissue? So mom's delivering a baby. She signs a consent to have somebody collect the tissue, that she is not paid for this. And that actually is a key point, because when I was looking into this originally, I'm like, oh, you pay these people? No, because that would attract all sorts of the wrong people that just want to sell this stuff. So they're not paid for this. These companies contract with these physicians, and the physicians ask their patients if they'll donate these tissues. That tissue is donated to these companies. Usually the physician gets something from that. I don't do it, so I don't know what exactly occurs, but that's what I understand. Then these companies take that tissue and they process it. They put it in their lab. They first test it, make sure there's no infections that are known. This is an important point because there is the small possibility that these tissues will have some type of infection that we don't know about. So this happened when I was in medical school back when HIV came out. We were testing people for all sorts of things and they were good, but they were still sick. And well, that's because it was HIV and we didn't know about that yet. So that's theoretically possible, but small risk of that. The fluid or whatever the tissue is tested for all of these known infections. And if there's any, they don't use it. Then what they do is they process it according to their proprietary techniques to get the most growth factors and theoretically cells in there. And then it's frozen. And after a period of time, it's shipped to the physician. Like we have a -80 freezer that we put it in there. And then when we're going to use it, we thaw it out and then can inject it into a patient. So what's wrong with this system? Well, do the cells, the MSCs, the stem cells survive? Short answer is no. And I know this because the literature says that. I also know this because back in the day, lots of companies were coming up with these products and we would test them. I would send it to a lab and we'd look at it and see how many live stem cells they had and guess how many they had. None. None were alive. So there were dead stem cells in there. So that's the snake oil part of this. And this is the fiction. So I don't want my old stem cells. I want the young, healthy cells from the baby. Well, you just don't get them because they're dead. And probably not surprisingly, I've asked the companies for their data to show me that they have live stem cells. And amazingly, I just never would get the data because it didn't exist. So perhaps there's a system that will become available where you can get live stem cells, but I'm just not aware of any of that at this point in time. So if you're considering any of these type of therapies, you can ask for the data. So, hey, you're talking about young baby stem cells, again, not embryonic, but from the products of conception. These stem cells are much younger. Ask for the data. Show me the papers that show there's any live stem cells in there, and you're not going to find any. Now, don't get me wrong. I'm not saying these placental, amniotic, umbilical tissues are bad because they're not. They do have growth factors in there. And I've seen decent results with problems like mild osteoarthritis in the knee. Many years ago, I was involved in a study where we were looking at that compared to hyaluronic acid, and it did show promising results. However, I think it's as strong in terms of healing efficacy as PRP or platelet-rich plasma, and you can definitely get more bang for your buck with PRP than with these amniotic placental tissues. And remember, there's no live stem cells in these placental tissues. There's very minimal in PRP also, which is why you can use bone marrow or fat, which do have live stem cells. And there's another problem. In the United States, federally, it is illegal to use these tissues. In Utah, as of the 2024 legislative session, it is now legal to do that in Utah. And so we're starting to see more and more advertisements from people trying to take advantage of this. If you decide to look into any regenerative orthopedic procedure, here's some things you need to look for to make sure you're not getting snake oiled. So first, is it a medical doctor doing the injection, or is it a nurse practitioner or PA or somebody else? Now, I'm not saying bad things about PAs and NPs because I know some really good ones, but you just want to know what you're getting. Guidance is another thing. How are they getting the needle into the right place? Often what I'll hear is, I don't need to, or patients have told me this from places they've gone to after the procedure was unsuccessful. And I'm asking them more questions and they say, yeah, they told me it didn't need to get into the right place. The stem cells are going to know where to go. I just got to get them close in there. Well, that's not Exactly right. So you need to have some kind of guidance to get. We use ultrasound, using to guide the needle in the right place. You may hear, I don't need anything to guide it. That's a whole nother podcast on do you need guidance to get to the right location? Short answer is you want laser guided bombs. You don't want carpet bombing. You want to get it in the right place. It's going to work better. You also want to ask them about their experience. How many of these things have they done? When did they start doing it? Last week, 2 months ago? This matters. We started doing this in 2007. You also want to ask the person doing the injections whether they've had it done on themselves. That's really a key point. If they believe in this, they will have had it done on themselves. I've had it done on me multiple times for different injuries, and I can relate to my patients many times with their exact injury, sometimes not because I haven't had all injuries, thank God, but I've had too many to name throughout my life, and I've used these regenerative techniques to help me to heal and heal better and heal faster. So you want to know about their experience. Another thing to consider, do they only have a hammer and everything looks like a nail, even screws and bolts and nuts and things like that? So they're going to use their hammer all the time. Translation, do you have other options rather than these amniotic, placental, umbilical tissues? Because it's not great for everything. So you want to have other options and you want to be able to match up the injury, the problem with what you, the patient, wants to do. It's not all the same. Maybe some people want to run ultra marathons or do triathlons or ride their bike or sit on the floor and play with their grandkids. Different things, and you can match up the different types of tissues with the problem and what the patient desires. We have that ability here. We do PRP, fat, bone marrow. Haven't delved back into the amniotic placental world yet, but I'm not averse to it. Just haven't had patients ask for it, but I would. It's legal in Utah now. When you're deciding on these procedures, you really need to have an apples to apples comparison. Just because you get, say, PRP, let's pick on that procedure for here for a minute. Not all PRP is created equal, and not every person, doctor wise, we talked about that, is equal. Everybody doesn't use guidance. You don't put the needle in the same places. So, for instance, when we do knee injections, many times we will inject the meniscus, we'll inject the medial collateral ligament, the ligaments surrounding the meniscus, and the capsule on that side that's problematic. Other people will just go into the joint. Those are not the same procedures, and you don't know that unless you know enough to ask about it. Is there an ability to manipulate the tissue, such as PRP? There's ways to get more or less platelets, ways to get more or less white blood cells, ways to get more or less red blood cells. Do they have the ability to do this? Do they, even if their system has the ability, do they know how to do this? We have that ability. Is the PRP concentration measured pre and post injection to know, was it really successful? For a while, there was no ability to realistically do this, and you were just relying on manufacturers' guidelines and their recommendations and their N of 5 patients that they did the study on that said, this is what we found. And everybody's different. And you need to be able to know what you're getting. And if the procedure didn't work, why did it not work? Well, because I got no platelets in there. And why did that happen? So you need to be able to understand that. Is there a database to keep track of the results of not just the individual patient, but all of the patients, and then compare that to other physicians in the database? We have that ability to do that, and we can see if somebody individually is doing as well or better than what most people get from that particular procedure. And you can tie it to specifically just PRP, fat, bone marrow, amniotic, whatever. You can decide what they had and compare. In conclusion, we've given you some defense against the snake oil salesman out there so you can have a successful regenerative experience. Don't be fooled by these snake oil salesmen. They're out there. Thanks for listening to Live Better Without Surgery. I hope you found today's discussion enlightening and empowering. Keep in mind that non-surgical alternatives can lead to a healthier, happier you. Until next time, live better without surgery.